Hello, dear students. I am Dr. Dharmendra Singh, your psychiatry faculty in PW MedEd. Today, in this video, we'll discuss that how psychiatry branch, what's the future, the earning potential, what are the positive, negative about this branch. So, who can take this branch? Once you get the rank, people have sometime they are not able to take a decisions that which branch I have to opt for. So today we'll discuss about psychiatry. There are few queries persistently, students asking. So the first query that who should take psychiatry and who should not. Okay. As a psychiatrist and psychiatry faculty, I want to tell you it's nothing. Sometime person say that sir, I'm introvert. I don't have a good communication skills. So see, don't see this as a negative. You will take a psychiatry over the time during your residency program. You will, learn this subject, and simultaneously you will come to know about yourself as well. Because this is a branch I think where maximum person learn about himself or herself. So if you have some limitations, you can overcome them, easily through your residency program. There are seniors, they will help you. So it's not like you have this issue then you can't overcome and you can't take the psychiatry. So it's nothing like that. If you have some, like, you feel over the time you will overcome, you will uh, address that issue as well, and you can become a good psychiatrist. Second, the sometime people take psychiatry, that it's not very hectic branch, and the easy, the life will be easy, but it's nothing like that. Depend from where you are doing your residency program. Suppose I have done from PGI Chandigarh, and I can tell you that it was one of the hectic department in PGI Chandigarh. So, and it was so hectic, even currently I don't want to you know recall about it. So depend from where you are doing. If the and see, you have to do the residency, you have to try from a good government college or the institute, because the training, in various institutes the training level is different. So try to opt for a good one. If the patient portfolio is a lot, then yes, the don't think that psychiatry is a very light branch. So residency will be hectic, and it should be, because it's a learning period. Once you are out, you are now psychiatrist. Nobody will try to teach you, because once you are student only you can learn. Then after completion of your residency, people will look at you that you are a psychiatrist, you are a complete psychiatrist, and then there is no scope of course throughout the life we learn, but the basic you should know. So this is about the whether it's hectic or not. Sometimes people say the future scope. What is the future scope in psychiatry? So future scope, the earning. See, earning, I think it's not about psychiatry only. Earning depend that what's your goal, what's your vision, your planning. Suppose if you are in a government job, uh, earning will be same in various branch, like the payment will be same. So in psychiatry is more about the private practice. Because private practice is easy in psychiatry. You should have a the table chairs, your the chamber, and you can start. Don't There are not so many instruments you have to buy, you have to put a lot of money. So you have to think that from where money will come. So private practice is easy in psychiatry. And once you start the private practice, and see, this is a positive point. In other branch, suppose the cardiology, the ophthalmology, in other branch, basically when like you start the practice, you need so much money for the establishment of your center. But in psychiatry it is not the case. So this is a positive. Sometime we are not able to start the some people, many of us, we want private practice, our own center, and flourish. But sometime because of the financial crisis or the financial burden, we are not able to take that step. But in psychiatry it's an easy way to take this step. So suppose you want to earn lot of money in psychiatry, you have to go for private practice, then the de-addiction center. There are various nowadays therapies we have. So inpatient facilities, if you have de-addiction center, RTMS, many other, gradually will come to know about it. So if you have this setup, then you can earn a lot of money. You can like a you can uh, equal yourself with surgeons or any other branch. So depend, earning potential is there in psychiatry, but depend that what kind of mindset you have, whether you want to go in a government job or in a private sector. So I think this is a, usually we discuss that what is the earning potential in this branch. Every branch has earning potential, depend what kind of steps you are taking, whether you are going for government job or private sector. And in private sector, what is your backup, or how much your family can help you, accordingly you have to decide. So in psychiatry also we have lot of earning potentials. uh, okay, sometimes people think that can I develop a psychiatric illness, psychiatric illness, if I become a psychiatrist. This is a myth, dear students. It's nothing like that. Even I'll tell you, suppose you become a psychiatrist, even suppose you have some genetic from family or some issues in you, even you will come to know that these are the issues and you can address them easily. Because not even the common society person, even the doctors, sometimes they are not, because sometime in MBBS we don't have a good psychiatry nowadays, that we are more focused on psychiatry. Before, that even psychiatric, during MBBS we are not taking so seriously. Even the doctors I have seen from different branch, they are also not very serious about psychiatric illness, that okay, isme kuch nahi hai, some you give some medication, some benzodiazepines like this. So uh, even you become a psychiatrist, you will come to know about yourself in better way, your psychological health, your mental health, and even you have some issues, so you can overcome them with easily, because you know how to tackle them, how to handle them. So it's nothing that if you become a psychiatrist, then you, because see, uh, like during internship, suppose sometime first time we have seen the death, we become so, like we get upset, we become sad. But later on, uh, we are easily, people are coming, sometime person dies, and we take it easily because we are used to it. Same way, every day when you are seeing the psychiatric patient, you seeing the various cases of depression, anxiety, various psychiatric disorder, then what happens, you are used to it. Now you know how to, you know uh, draw a boundary between you and you, the patient, and how much emotional you can get involved, that you automatically you get trained to that. So it's not like you are every day seeing these patients, so you will get affected. So nothing, like it's a myth in psychiatry. It's not like you will become a psychiatrist so you'll get a psychiatric illness. Okay, what are the limitations or the cons in psychiatry? Yeah, two three things are there. About the positive thing, it's a, like when I took also psychiatry, I took psychiatry in a very good rank in PGI Chandigarh, and I was getting other branches as well, and my friends told that why you are taking psychiatry, but I knew that it has a future, because in many other branches there are so many, you know like already the competition is there still. There is also a scope, but in psychiatry you can say that still we have a lot of scope. It's a, now it's not, we say, emerging branch, it's already emerged, but yeah, still there is a lot of scope. So you can work in our country, you can go abroad. It's very easy to go abroad if somebody has a, like willing to go abroad and get settled. So it's very easy in psychiatry. uh, there are so many new medications, many options of treatment are coming, so there is a lot of scope of research in psychiatry still there. So if somebody is interested in research, I see that in that way. Limitations, like, or the cons in psychiatry, yeah, two three things are there. Number one, yes, the private jobs are little less, because in other branch you will go to corporate, the private hospitals, they will take you on a salary basis. In psychiatry it is little difficult. Corporate will not take you suddenly, because there are mental health act, there are many other things. The corporate are not very friendly and aware about the psychiatry, so they have some apprehensions about psychiatry. Now it's not, but yeah, still it is there. So um, sometime you easily suddenly will not get the job in psychiatry, but that's a positive point that you will open your clinic and gradually, usually sometime we get the job, we don't take that step that we open. So initially you will feel little key, you will feel struggle, but later on in 2 3 years when your practice is fine, then you will not regret that decision as well. So there is a positive in negative, that you corporate will not take you suddenly, you will open your clinic and then you can flourish. That's a one thing. Second, sometime yes, I have seen my friends also, sometime you are doing the residency program in psychiatry, the marriage issue, it's not like psychiatry that they don't get married, but people are sometime, uh, girl, family members, they are, little skeptical about it, and people don't accept directly. So if you have a love marriage, and then it's fine, but sometime it's not like so much struggle, but yeah, that's a sometime it happens, because in society still, yes, we are using this word stigma, taboo is there, but it is gradually people are more aware, people have acceptance, the more the education about it, and people are taking this branch normally. And I think in next 5 to 10 years, what we are talking today, this will, subside, it will go away, there won't be any taboo and stigma. And when we talk about the taboo and stigma, see, it's not only psychiatry, you will see the oncology, the neurology, other branches, even epilepsy. Till now, we are saying ki, it's a upri hawa ka chakkar, or some other things are there in epilepsy as well. So it's not about psychiatry only, in other branch also sometime stigma and taboo associated with it. So this is about psychiatry, that you have a good potential. It's a like branch where a lot of scope of research, if you do from a good institute or the good government college. Sometime people say कि, sir, I have, what's the scope of private college? In private college, yes, if you do, if you have a good money, family can afford, you can do it, and later on you can do the residency program from a SR ship, from a good college, if you'll get it. And there, if you have some, like loopholes, or some you did not learn well during your residency program, you can learn from there in your senior residency. So this is about the psychiatry, but as a psychiatrist, I want to tell you, it's a really good branch. Yeah, sometime it happens that when you in psychiatry, initially you can have a feel that it's like a, this medical wala, that whether I am handling patient medically or not. And initially we are thinking more about drugs, but yes, I want to tell you, psychiatry is about the medication plus psychotherapy, counseling has a equal effect, or maybe sometime more, depend on a psychiatric disorder. So sometime initially people can feel that it's not a medical thing, that I have, because during our MBBS we talk about more molecules, the drugs, and the heart, kidney, and suddenly we talk about the psychotherapies, counseling. So sometimes people are not used to it, but psychiatry is about the pharmacological plus non-pharmacological intervention, medication plus psychotherapy and counseling. And it's really, we have amazing treatment. As a psychiatrist, I realize that we have such a good treatment in psychiatry, that after 5 year, 10 year, 15 years, 20 years, we can treat the patient, which is not the option in other branch. In other branch, sometime person can die within, even few hours or the few days, not about the month. But in psychiatry, the illnesses are chronic, and even sometimes person don't get the good treatment, and later on he finds someone, and he gets treated. So it's a satisfaction in psychiatry. If you have a good hold on psychiatric, treatment, you got a good residency program, it's amazing. I'm telling you, today I can say that I have never seen the patient who did not get, treated. He came to me, and patient did not get well. Such a good treatment we have in psychiatry. So as I feel, as a doctor, as a psychiatrist, that when you treat the patient in other branch, you only treat the patient, but when you treat the patient in psychiatry, you treat like a family. You have a good relationship with family also, because psychiatric disorder have a lot of burden in family also. So in that way also, it's a very satisfactory branch. It give a good satisfaction when you have a good skills in psychiatry. So this is all about psychiatry. If you have a little, in your mind that I want to opt, that you can opt this branch. It's having a good future in our country, in abroad, a good treatment. You can start the private practice. Lot of earning potentials are there. Okay, so if you have want to take it, go ahead. Nothing to worry. We need a lot of psychiatrists. And about saturation also, people say ki whether this branch will get saturated or not. See, still this is a branch, I think, where we have a very less psychiatrists in our country. So uh, nothing to worry about the saturation, that we need more and more psychiatrists. So that in that way also, nothing to worry. So opt for it. Thank you so much.